Hi, thanks for stopping by. I'm Michelle, Couture-Souvenir, Doctor of Audiology, and I'd like to discuss and help you with some hearing help. Today, let's talk a little bit about what is the difference between an audiologist and a hearing instrument specialist. In order to go into that subject, I would like to go back a little bit in time. Back in about the 1970s, audiologists were the diagnosticians and those that provided oral rehabilitation for hearing loss. Hearing instrument specialists were the ones that were licensed to sell hearing devices. So audiologists would test and diagnose, and if a hearing aid was recommended, they would then refer the person to the hearing instrument specialist to purchase hearing devices. Well, audiologists quickly realized that leaving this large portion of rehabilitation out of our scope of practice wasn't a very smart thing to do. So audiologists fought for the ability to include hearing aid fittings in their scope of practice, which caused a battle between the two professions. Good battle, bad battle, nonetheless, it existed, and today both professions are allowed to retail hearing devices. Is one better than the other? Well, with everything, audiologists, some are great, some are not so. Hearing instrument specialists, the same. But there are differences. One of the biggest differences between the two professions is education. Audiologists are now required to have a doctorate level degree to be able to practice audiology and be licensed within their state. That entails about 8 years of studies. A hearing instrument specialist, depending on the state that they're in, may require an associate's degree, or they may require a 6-month certification course. Another big difference between the two is the ability to do research. Audiologists have historically been very research-oriented to determine what are best practices within our profession, where hearing instrument specialists have not. They've been trained to be able to do some testing to determine what hearing aids are necessary and to be able to fit that hearing device. So we have research, we have education, and another one is credentialing. Audiologists are typically credentialed by our professional organizations, one of them being AAA and another one is ASHA. Hearing instrument specialists may pursue certification for their profession, but not always. Big differences in those regards regarding education, research, and certification. I hope that what I've just provided for you helped you understand a little bit of the differences between an audiologist and a hearing instrument specialist. Thanks for stopping by.